Good afternoon, everybody, and welcome to Zahn Academy. Today's webinar is on Nemotec, which is a really revolutionary option for all your surgical guide needs and treatment planning. And it's a great software. And today we have Daniel Alter, who will be presenting for us. So thank you so much, Daniel. And Daniel is an MSc MDT CDT. He is the professor of restorative dentistry for the City University of New York and also the executive editor of Inside Dental Technology magazine, IDT. So we're so thankful for you to be with us today, Daniel, and to give some insight on this really great software for our laboratories to take a look at and possibly want to incorporate into their lab. Daniel was kind enough to put together some poll questions because we would love for you to be as really interactive with us as you possibly can, so we could just learn about what it is you would like to do and what you already are doing in your laboratory. So please answer the questions when we put them up. They'll be done sporadically throughout Daniel's presentation. We will also be doing a Q&A at the end. So please type in your questions at the bottom of your toolbar, and we will answer those at the end as well. So I'm going to turn this over to Daniel. Everybody, enjoy.
Awesome. Thank you so much, Fran. And thank you, everybody. It's both an honor and a pleasure to be here with you all. So certainly, as you know, I'm always an advocate for our profession and how we can perhaps do things better, more efficient, and ultimately derive with a way of creating greater revenue. And this software that is Nemotec is really a very robust software, to say the least, because as you'll see as I go through the presentation, what you can accomplish with this software is truly remarkable. It is also, I have to say, a software that is an application on your PC, on your computer, as well as it has a cloud-based, for communication, approvals, and so on and so forth. So it's truly remarkable of what you can accomplish with this. And if you're currently a laboratory that is providing surgical guides, I would encourage you to look at this because it does make things significantly more seamless, as well as allows you to really be able to do some tremendous things. Notably is the stackable guides. So you can do a stackable guide from a very conception with the diacom file all the way to the finalized case, including in the software, you can even do, and I'll demonstrate for you, you can even create a custom abutment as well as the prosthetic and the restorative thereafter. So in one software package, you can really get to the point of not only planning and creating a surgical guide, but also having ultimately the end result in mind. So with that said, as we go through this, and I'll share with you the different modules that come with the software, and it's truly, you'll see, and hopefully by the end of this hour, and again, I'm incredibly grateful for the hour that you share with us, because in this hour, my hope is to be able to show you all the different opportunities that are available for you. And again, each laboratory may have a different pathway or a different journey through this, and it could really satisfy many different products as well as solutions for your laboratory and ultimately your clinicians. And the benefactor of this, which should always be, is the dental patient ultimately. So a little bit of history about Nemotec. They've been around since 1992 and have continued to innovate as they've moved through the progression of integration. All the way in 1995, they had the window-based imaging software to where in 1995, the Nemotec is what was born from that. And that also allows for a opportunity to do some orthodontic surgery and guides and so on, which I'll touch upon. The focus of this presentation is going to be regarding the implant planning as well as implant surgical guides, but I'll also share with you the other modules, which are, again, the Nemotec, the Nemo Studio, the NemoScan, NemoFab, which I'll explain what each one of those means. So that's where the Nemotec kind of suite has. So when you get into this software package, which again has a application on your PC, and it's a very incredibly robust, and when you see, I'll start designing in a little bit, you'll see the functionality and the ability of really being able to incorporate in a tremendous way a lot of data sets, which are incredibly important, because the data sets, as well as the face scans, as well as the DICOM file, and so on and so forth, allow us to really do some sophisticated implant planning and surgical guides. But they even allow, in this case, to do some with Nemocast and Nemocef, some really orthodontic diagnosis and setup, as well as aligners and indirect bonding, all the way to oral and maxillofacial surgeries, which is the way we're going to close off this presentation. So it's a truly comprehensive, but yet very, very, very robust. And I can't emphasize that enough. And not in robust, when I say robust, it means that we have a larger tool or a larger assortment of tool within our toolbox. We may or may not need everything, but I'm of the mind always, whether it's with software or with any kind of solutions, that I'd rather have and not need rather than need and not have. So that's where the robustness of this software is really impressive, because it truly has everything that you could possibly need in order to prepare or create or fabricate, whether it's again, surgical guide, a smile design, or orthodontic, or even maxillofacial surgery. So where's the opportunity? I mean, the opportunity is incredible for us here, and specifically in surgical guides. And this is just a quick kind of matrix that I've grabbed from where there's an estimated of 40 million people in the US that are wearing dentures, which in translation, that is a $240 billion lab market for the implant space, as well as a $1.1 trillion market as well. So what does that mean, and what does that mean for us? That means that there's plenty of business out there, should you want to pursue down this road and this journey, to be able to facilitate a truly implant-supported prosthetic. I don't know about you, but what I find is that many denture wearers truly have a difference in the way they masticate, and more importantly, in their nutritional value. And oftentimes when you're engaged in implant-supported prosthetics, one of the first things I hear from patients that are converted from a denture to an implant-supported prosthesis is that their selection of food is significantly better. And for some reason or another, they always seem to say, now I can finally eat steak, where with a denture, that wasn't an ability for them. And that's why it truly affects their nutritional value, because a person that doesn't have confidence with their teeth, or they don't feel confident with how well they can bite down, what do? They select softer or more processed foods rather than a healthier, more nutritional, protein-based diet. So when you're changing, or when you're creating an implant-supported prosthetic through this workflow, or any kind of workflow, you're restoring somebody's not only confidence, but you're restoring their overall health in a great way. And if 40 million folks are currently wearing dentures, that's a tremendous opportunity that we can really seize and tap into. And it's a revenue stream opportunity in the greatest of ways. So the first thing we're going to start with is what is considered a Nemo scan. Now, again, it's one of the 4 modules of the Nemotec. And what this one is going to be the focus of our presentation today, which has everything to do with implant planning, guided surgery, as well as immediate loading prosthesis, which is a tremendous benefit, because not only can you, and I'll show you the landmarks, the mandibular landmarks, as well as the sinuses and how to identify them, and the ability of placing a prosthetically driven placement. Why do I say that? And I'll show you in the videos as I go through, because we're first going to place where our ideal prosthetic is going to be. In the demo that I'm going to share with you, it's going to be two distal molars on the lower arch. Now, oftentimes we get, and certainly maybe I'll age myself at this point, is where you open up a lab bag, and the first thing you do is you look at an impression, and all of a sudden the impression coping is going out to left field, and you sit there and you scratch your head and you say, well, why is that? I mean, the access hole is going to come out in a very aesthetic area. It may compromise the overall prosthetic. So you pick up the phone, and typically a dentist would say, well, that's where the bone was. And I agree, that may very well be where the bone was, but that's not the only place where the bone was. And that's where the benefit of software such as this, that you can really bring in the DICOM file, which I'll discuss in a second, the importance of it, as well as the static scan, to be able to garner that information of where it is that the bone density, because now we can place the implant, everything virtually, but we can place it or mock it up in exact density markers so that we know it will osseointegrate well. But by doing so, we're also placing it under where the prosthetic will be. So now we can really be in the driver's seat and control the outcomes from before we even get started, which is a very powerful mindset and a method of doing it. So we're not reactive in the way we've traditionally done it, where we have to restore the implant supported prosthetic, whichever way the access hole ended up. Now we can actually plan out where the access hole is going to come out not only in an area that is not going to affect the aesthetics, but it's even going to make the functionality of that restoration significantly stronger. And I'll show you all the way through the entire process. Then you can also improve the quality and the speed of the treatment. You can do this rather simply and easily. Again, there's a little bit of a learning curve. I'm not going to, sugarcoat it, but in reality, what you really need to understand is which landmarks to stay away from. So for example, on the mandible, you want to stay away from the mandibular nerve, and I'll show you how to identify and highlight that. Then on the maxillary, you want to stay away from the sinuses unless you're doing a sinus lift. Otherwise, the bone is really a matter of density units and where the anatomic structures are to truly be able to place an implant in its significant and viable way. You want to have proper stability, and this is the absolutely best way of doing it. And the nicest thing with this software is that you can visualize it in multiple layouts, and even the layouts are very customizable, and I'll show you what I mean by that. So there's a tremendous amount of benefits that we'll go through, and the NemoScam is the first one. Now, what does that mean? That means that, there's multiple different types of guides that you're able to offer through this software. You're able to offer a drill guide similar to here. You're as well, oh, my apologies. You're able to offer drill guides similar to this, where for those cases where anatomical and surgical kit conditions don't allow for a fully guided. So that means that it's a tooth-borne type of surgical guides. You can also place implant guides where it's a more fully driven or obtained in surgical planning. And ultimately, as you see here on the right-hand side, it's the stackable guides. So my apologies. I think we just had a polling question. So if everybody could kindly answer them, because Fran is tallying them, and I'll continue on. So the stackable guides is what I'm very, very excited about, because it allows you to do a multiple stackable, as therefore the name, where it starts all the way from a bone reduction guide all the way to the final prosthetic, or rather not the final, but the provisional for immediate loading. So you can start from a extraction to a bone reducing guide to placing the implants, all the way to the provisional of a conversion or immediate loaded, all within one effort and one design. So it's really a tremendously robust software, as I said. And here you have some more examples of the drill guides, the implant fully guided, stackable guides, the healing abutments, the temporary restoration, as well as the sinus lift guides. So what you can do and what you can accomplish, and I'll show you the drill guides as well as the implant full guides, and the healing abutments that we were able to do, as well as the temporary restorations. So if you're doing just one, as you see here in the temporary restoration, you can actually, while you're designing, it'll give you the STL file so that you can print out the immediate loaded temporary. So you can provisionalize it immediately upon loading that implant, in the clinical office. So it provides for an assortment of solutions and really processes to really make things that much better. Now, when it comes to surgical guides, there's two avenues that dental laboratories can really deploy in a great way. Number one, as you see trends in dental laboratory and dental restorative dentistry, that is, one of the largest trends is that there's more and more general practitioners that are placing implants. Now, mind you, most of them are single implants and they tend to be in the posterior region. But nonetheless, general practitioners are looking to capitalize or monetize their patients as well as their time by placing implants rather than outsourcing it. So now many are doing it, and many are kind of on the fence and want to do it. And if you look at a laboratory like yours, who are most of our clients in a laboratory? They're general practitioners. So there's a very good chance and a very good likelihood that some of your clients would be interested, or if they're not interested, they're doing it currently right now, that this could absolutely help them. So if you're not doing surgical guides, I suggest you inquire about it and take a look at it, because it could be a benefit for not only your existing dentists that are currently doing it, that you can help them really fulfill a revenue stream, but perhaps there are some clinicians that within your network and within your business that desire to be able to place implants. Again, with these surgical guides, it's planned out so well and methodically that you can even take it all the way to the provisional step, that for lack of better terms, it's truly like holding their hand in a successful way. But the best part about it is that the general practitioner, you're creating a revenue stream for them that they didn't have before. And thereby it creates a revenue stream for you, and ultimately the patient benefits from it as well. The second opportunity for dental laboratories is to align with a oral surgeon in order to do these type of implant supported restoration, starting from surgical guides. Now, obviously, oral surgeons, certainly they do single implants, but they typically tend to do larger, more complex cases, and that's where the stackable guides really come in handy. Now, again, being that this system is a very prosthetically driven guided surgery, you can literally have them go from step zero all the way to a provisional. But the best part about it is that most oral surgeons, depending on geographic area, may have a network of anywhere from 50 to 1,000 general practitioners that are sending them work. So if a Dr. Smith, who's a referring dentist, calls the oral surgeon and says, which laboratory should I restore Mrs. Jones's case with, that oral surgeon is going to say, go to lab X, Y, and Z, because they've already created this. Everything was already done in the software, and all they need to do is now execute, because they've planned it all the way through. So if you want the winning recipe, that's the lab you should go to, because it's already a done deal. They've already figured it all out before we even got started. So it's truly a remarkable way for laboratories to really engage with oral surgeon as well as the general practitioners in order to create more revenue, as well as create more business for the laboratory, and ultimately also for the clinician as well. Now, what is great about all this is obviously the ability of data and data transfers. So there are several things that are needed in order to do this successfully. There's the 2D X-ray, which is not something, that is needed here. However, we do need two, one of them being a DICOM file, which is a cone beam scan, as you see here on the right, as well as a static scan, and I'll explain why. So the cone beam scan that you see on the right, it's radiograph, and it's small slices that give us a lot of information. That information is in the root of the density, as well as the landmarks, where the mandibular nerve is, where the frenums are, with the segmentation of teeth, and so on and so forth. However, it is not geometrically stable. Therefore, you cannot fabricate or design and then fabricate a surgical guide on top of it, because it gives us a plethora of information, but it's not geometrically stable. And that's where the static guides, or the static scans, which are either iOS or even a impression where you pour in stone and then scan it in the laboratory, but that becomes your geometrically stable scan. So we'll use the cone beam, as you'll see in a second, in order to understand and get a lot of our information, as well as density markers and so on and so forth. And then you're able to use the static scan, either iOS or a laboratory scan, in order to fabricate our surgical guides. What's really cool is now, with the integration of different scans and different technologies, we can incorporate even the patient's face. And, as you see here, so there's face scanners, you can do it in 2D, and there's some examples I'll show you throughout this presentation, where you're incorporating the patient's face and the changes happen automatically. And there are even some AI platforms that allow for videos of the patient speaking. And while the patient's speaking, your restoration or your proposed restoration is going to be virtually placed into that. So what does that do? That not only gives us a lot of information as to what it is that we're trying to accomplish, because we have the more information we have, the easier and better it is for us to get to the end result. But it also allows for a greater patient acceptance when they're seeing the end result in their mouths and they're speaking and they're being very fluid. It just resonates emotionally with them rather than seeing a model, for example. Oftentimes we do a diagnostic wax up, they look at the model, but it doesn't always translate to what it would look on them or in their face. And then having this software where it shows them what it would look like. So they're almost seeing like two snapshots of what it is before and after, before anything is even done. It's an incredible patient acceptance opportunity that really allows us to grow in a big way. So when it comes to our designs, first thing you want to do is you want to create the arch tracing, and more importantly, as I said, the nerves and the sinuses. So here's a example where I've incorporated my DICOM file, and I'm going to start first and foremost by tracing my arch, because once we trace the arch, and each arch is slightly a little bit different and not perfectly symmetrical, and you'll see what I mean by that, is we're able to trace the arch while also having a slight variations of everything in through. Now, why do we need that? We need that because we want to make sure that as we segment the individual portions, we're able to really dial in exactly to the location that we want. So one of the first things we're going to do is we're going to make it as centered, if you will, so that we're looking at it from the perspective of the patient. Now I'm tracing the arch from patient's left to right, and it's really irrelevant which side you choose, but just as long as you go across arch. And now we're able to look into the bone. So we can see the number of slices which we can control. And on the right-hand side, you're going to see soon that it's going to slice it for us once I press OK. And then all those are going to go into on the right panel. Now you have the ability of customizing it. So depending on how it is that you want to see things, you can customize it. And if you see, I can even move or toggle the slicing that I'm doing. Because one of the first things I want to do is I want to see exactly where the mandibular nerve is, because the mandibular nerve is something that we have to stay away from at least a millimeter. And the software does a very nice job, which it turns red if you're too close to that. Now, the first thing and the easiest thing when it comes to mandibular nerve is to finding that, as you see there, that little hole, the mandibular frenum. So once we establish where that is, I'm literally going to click on it, and it's going to give a very small red, and that's where the mandibular nerve emerges out of, and it goes all the way up to the temporal mandibular joint. Now you're going to see a canal there, and as you can see, you can expand and shrink exactly what it is, and what planes you want to see. So the information is plentiful, and there's also a ruler at the very top. So now I'm actually using my scroll wheel on my mouse in order to extend it further lingual. So I'm just tracing, if you see up here, I'm just tracing exactly where that mandibular nerve is, and then I'm going to capture it, and it comes out through the mandibular frenum here. So you can see it all the way through, and now it's not going to compromise in any way, shape, or form. I can also click on it and expand it, make it wider, make it narrower, whichever it is, in order to fill that canal in the best way that I could. Now that's really in order to validate, and then the software does fill in the space, but what it does is it gives you another segmentation on the right-hand side. So you can see, you can toggle from the bone to the upper model. Now you also have the inferior nerve, which is now gonna, as I'm designing, I'm doing the other side now, which is the patient's right side, in order to establish both. So here you'll see again, I'm going to look for the frenum. I'm going to find it, and then I'm also going to look for the sinuses, as you see up here. So here I'm identifying where the sinuses are, which is right here, and I'm going to plot it all the way through. So the idea is I'm going to remain on one side just for demonstration purposes, but I want to make sure that I identify where the mandibular nerve is, which we did already, as well as where the sinuses are. And you'll see with the sinuses, I'm just going to plot around, and it's going to have almost like the shape of, for lack of better terms, like a kidney. And you'll see it in a second. And what that does is it detects it naturally as a gray space. and thereby protecting it. So what do I mean by protecting it? As we're placing, and you can see hopefully at the very top left, that is your sinuses right here. And as well as here in the image, you can see that that pink is where your sinuses are, and you now have a segmentation that you can either include or take off as you're designing these. So those are the two things that you really want to be mindful of to make sure that you're capturing those two, because we want to stay away in any way, shape, or form from those. Now, why is that? That is, as we're placing the implants, which we'll start in a second, as we're generating, if the implant gets too close to perhaps the mandibular nerve, that can lead to, or if you damage it, God forbid, that could lead to irreversible parallel. The patient will feel paralyzed in that, because that mandibular nerve is very important. Obviously, with the sinuses, you don't want to perforate it because that's a whole host of other issues. So what happens is when we place that implant, if you get too close where it may compromise the either the mandibular nerve or the sinuses, that's where it's going to turn red rather than green, indicating to you that you've gone too close or too far next to these anatomical structures, and to actually, back off of it. Here now, we're going to take a look at the models. Now, the models allow us, and again, this is a static scan, so it could either be an iOS scan or perhaps a tabletop scan, depending on kind of the flow, or the workflow, I should say, that the dentist chose. First thing we're going to do is we're going to take a look at the arch. We're going to place it over the arch, and obviously this is a U arch. However, we're going to bring it in slightly. We're going to also take into account the curve of Spee, the curve of Wilson, as you'll see in a second, just to make sure that the occlusion is appropriate and correct as well, because we want to capture that information. Our example here, as you'll see, is going to be, we're going to do two distal molars. So we're setting up in order to create that. So first thing we're doing is we're setting up the arch. We've already identified the mandibular nerve. We've already identified the actual sinuses. Now we're placing it where we want, whether it's symmetrical or not, to be able to follow the arch, because the next thing we're going to do is we're going to introduce the prosthetic. And as I said, the software is prosthetically driven. So we're going to first place the restoration, and then we're going to find the ideal placement of that implant underneath that restoration to give us that good end result, or that outcome that we're looking to achieve. So we're going to place that in. So now it's conducting for the curve of Spee, as well as the curve of Wilson, which is has a lot to do with occlusion. Now we're going to select the prosthetic. So we're going to add the prosthetic. Now I'm going to show you, again, for this case, we're going to do the two further distal molars in this. However, you can do, and if you were to do a full arch, we're just going to add all of the teeth, as you see here, which we have in the software the ability of actually extracting teeth while replacing teeth. So that's a perfect example for the stackable, where we can actually eliminate or extract teeth virtually, in order to then come back and create a bone guide, as well as a surgical guide, all the way to a prosthetic, all encompassing within one single software, as you see here. So now that we've selected the two molars, it's going to populate it for us, or aggregate it for us. We're then going to utilize typical CAD/CAM kind of principles to do it, in order to place it in the right location of where I need it to place. Now, realize that the difference between this and what I found that's a great benefit to this, that's different than other software, is that most other software, and there are some other softwares that allow you to first design your prosthetic in order to place that implant in the location that you want. However, most, as far as I know, this is the only software that allows you to utilize that design in order to finish and create a immediately loaded prosthetic. So here again, you have, let me just play it. So here again, this is the restoration that we've virtually planned, that will then ultimately be our healing abutment, or healing restoration. Here you can open up different planes, as you can see here, but you can see the multiple kind of vantage points, as well as the panoramic up here, because we know where things are and we want to be able to establish exactly where those things are. So we're going to place the implant or look to place the implant. First thing we need to do is identify where the design of the virtual prosthetic is. I'm going to move these back just to make sure that we can mark the density units so that there's, we have the proper stability, we have the proper viability for these type of restorations. And what you'll see is we can superimpose it in 2D or 4 or 3D over a static, as you see here. The nice thing is everything is integrated, everything aligns, and as I move one plane, it allows me to see it in a three-dimensional plane as well, so that all are very comprehensive into the design or the real thought process into creating these surgical guides. Now so these are the density units, and what you do is as you're moving around the bone, you can actually identify where the density units are. So typically over 500 density units is a well dense bone. Anything below that, it's you're risking a little bit of less osseointegration or longer osseointegration. I typically like to place implants in 500 or greater if possible. Obviously, it's not always possible, but if you can, then certainly the higher the number, the better. Now, once we've established exactly where those density units, as you can see, there was 912, 476. So you can pick and choose where you want your implant to be placed. And then we're going to go ahead and we're going to actually place our implant. So now when we place our implant, obviously the dentist is going to select what is the system of choice, whatever it is that they have the toolkit for, whatever it is that they want to place in that implant, and that's what we're going to utilize. And then we're going to be able to virtually place that implant of their choice. But yet we can still in the software, which is again another unique and interesting thing with this software, is that you can expand on it. You can make it longer, you can make it wider, you can make suggestions to the clinician as to what it is that the best surgical protocol would be in order to achieve those outcomes in those lines. So here I'm showing exactly where the mandibular nerve is. I'm going to select first the implant. So it's going to be on the patient's lower left 6. And once I'm going to add the implant of choice, I can literally drop it right underneath and into the crestal bone, as you can see here. I'm going to stay away from the mandibular nerve, and hopefully my focus is down here that you can see. So the yellow is, you can see it now, you can also see it in this plane. I can move this down, but you see the moment I moved it down too close to where the mandibular nerve is, now the implant fixture became red, which indicates to me that I need to move it out of that space. Once I move it away, at least a millimeter away, it turns either green or yellow, and then you know you're in the right spot. But notice what else is happening here. Now you're seeing exactly where that access hole is. You're seeing exactly where you're placing it. Do you need to move it? I would think yes, because now you can, without compromising the case, you can place that implant and have it facilitate for you also the proper emergence in the prosthetic. Because not only does it offer the aesthetics, obviously, so not to compromise the aesthetics, but the strength and viability of the prosthetic all in and of itself. So if you're restoring the lower or the mandibular, the lingual cusp or the non-working cusp, which is where your access hole should end up. If you're doing the maxilla, it will be the opposite. But one thing that you also want to make sure is that no function occurs on the access holes, meaning that those access holes is where oftentimes is the weakest point in the biomechanical system of the material. So if any function occurs on the access hole, that's where you may see some chipping and some failure. That is really irrespective of the implant. It is more the function, the biomechanical function of the prosthetic and the restorative material. So being able to angulate, if you will, or really establish where the access hole is going to come out of is not only a consideration for aesthetics, but it's also a consideration for the viability of the restoration and the longevity of that restoration in a great way. So you can see here on the right-hand side, so on the left-hand side is where you're doing a lot of the tasks. In the middle is all the visuals that you can see, and you can customize it from this window up here, but you can see there's anywhere from a dozen different windows and planes to just 2 or 3. On the right-hand side here is where you see all the visuals that you can toggle on and off. So if I wanted to include my sinuses in there, which is not now, I can certainly include that by having this eyeball. I can remove or include the mandibular nerve. I can the bone is what the diacom file is, the upper model, and so on and so forth, which is what you're seeing here, which is the just the lower static scan, which is the iOS. You're seeing the mandibular nerve. You're seeing the cross segmentation, as well as you're seeing where the implant is and the prosthetic here altogether. So it's really as I said, it's a very robust system that you can see everything. But hopefully what you can also see is not only is it robust, you can also customize it to exactly the way you want it to see and what you want it to do. And that's what I think is the best part of any tool. We can accomplish a lot with the tool, but how does it benefit us? And what in particular does it benefit us? One laboratory may be looking at a different source of information than another, or one may find it more important to see it from one vantage point or perspective over another. But that's where the benefit of this software, that it allows you to customize it to exactly the way it is that you want to see it, so that you can achieve those repeatable and consistent end results, which nowadays with surgical guides, I mean, the acceptance, or the success, I should say, of implantology has risen significantly from perhaps 15 years ago. It was, or maybe even 20 at this point, it was hovering about 80%. Now we're reaching, assuming all the health criteria are met, now we're reaching a success rate of 98%. And I really attribute it to the level of technology, the surgical guides, the acumen, the success that we as a laboratory community and a clinical community can collaborate to make it for the patient the best possible outcome that they can have. So here again, it's showing even down into what kind of sleeve you need and what kind of mechanism it is that you want to accomplish. And everything is within your control. So they have these libraries, if you will, that you can toggle back and forth. You can rotate if you want a plastic sleeve, or if you want a metal sleeve, if you want it glued, if you want it pin glued. You have all the options. And again, it's very dependent on the type of implant system that your dentist is going to select, but you have it at your fingertips. You have the ability of including any kind of prosthetic, any kind of implant component, and incorporate it into what you see here. So then adding the abutment, and this is where you can literally add an abutment all the way through. And I'll show you. So again, it's the same case. Now we see where our mandibular nerve is. We're seeing where our sleeves for the the guided surgery. We see where the implant is. We see where the screw head is going to end up, and all the way through. And then we can even, again, on the right hand side, it's collapsed right now, but you can see where the restoration is, and so on. So this is the healing abutment, or a healing cap, if you will. We can create, and some have requested, a customizable either healing cap, which you can do here, or you can even create a customized abutment that you can then place a provisional, obviously out of occlusion, as you see here. This system even offers you a prefabbed abutments. So you can do a custom abutment, but if you want, you can utilize prefab abutments at the selection of whatever is available in the market and place it, including angulating it, as you'll see. So you can see exactly where the heights are, and you can decide what kind of height you're looking, depending on the emergence of the tissue and how deep in the bone the implant is sunken into. So you can control the exact gingiva emergence. You can control the heights, and everything is, again, before the patient's even been seen yet. The only thing we've had so far is we've taken a diacom file and a static file. So now we can even customize or angulate the custom abutments in order to achieve a immediate loaded and immediate provisionalized restoration. So now we're looking at the exact implant. We've selected our heights of the healing abutments. We're looking internally to make sure that it is fits exactly where we want it to. We're looking in the area around it, as to see where the fulcrums are, what the benefits are, obviously. Now we're going to go ahead and reintroduce our, the ability of doing more crowns or what have you. So we can select that prosthetic. We can angulate it as you see here on the top left side, and then we can go right into see where the access hole is going to emerge out of in order to see. I think this case, in memory serves me correct, ended up being a scrementable, where we utilized that custom abutment to then do a Emax with a hole in it to finish it off. So, upon surgery, you can already make these decisions with the surgeon or with the general practitioner or what have you in order to really successfully have the outcome. Again, the benefit of this is you're in the driver's seat. You've already figured out everything before even starting the case, and you can generate something for the clinician that will have it in the patient's box that they can immediately restore it upon surgery, and even have the definitive, if so you choose, to have it ready for them once they're they're ready to restore. Once it's osseointegrated and it's ready to be placed into occlusion, you can have all that. And the benefit for the laboratory is that it's one effort. Everything is done in advance in the software. So now you can absolutely just rest assured and take it from even before the patient is seen or is in surgery. You already have all the componentry. Everything is done for you in a great way. So now, once you finish everything and you do the surgical guides, and which is, I'm going to create the surgical guides in a second, but it spits out or it gives you a PDF. So you can either do it via cloud or via PDF like this, and it gives you the protocol and the sequence of all the different drill, as well as the density and the coronal cut and so much more. Now, again, you have to have a licensed dentist to approve this before moving on into surgical guides. You can do this via cloud with a digital signature or PDF with a real signature. Just make sure, don't get yourself into any hot water. It's always the licensed clinician is the one responsible for the patient, and they are the ones who are in their care, and they have to sign off on this protocol. Everything else we've done is virtually, but before we committing to the surgical guide, because that means we're committing to the patient, it just needs to be verified and validated and signed by a licensed clinician. So then once you get that signature, I just happen to have, in the same case, I just threw some guide pins or just to kind of play around with it, but I left it there just to be able to show you. But so we've done a lot of the planning already. The surgical sleeve or the sleeve pilot is already there. So I'm going to go ahead now and create the surgical guide. Now the surgical guide has a very easy, they even have, I don't want to call it I guess it's AI, but it has an automatic kind of where it creates the boundaries of the surgical guide. But then you can also remove that and then plot it yourself. And I'll show you exactly what I mean. It's first going to propose. First thing you do is you block out, just like we would in a regular case or analog case. We first want to block out the model so that not to engage any of the undercuts when we're creating the surgical guide. We want it to be passive but yet accurate. So that's where you're blocking out in those areas so that our surgical guide is not going to engage in those areas. However, it's still going to fit very precisely and very accurately. And once I set up the exact location, I can even do the offset if I want it to be, here I have it set as the default is a 0.3 millimeter, but you can change that depending on what it is that you want to accomplish, as well as the maximum undercuts and what the maximum undercuts are. Again, different laboratories may have different preferences, different clinicians may have different preferences, but ultimately you want to be able to satisfy that. So now it created the model with that offset and the proper blocking out of wax. It can show you different distances as well as kind of showing where the where the model is. Now you can even go as far as on the model and block out should you want to in any areas. And then the next is going to be now it automatically created a boundaries as you see here for the surgical guide. So, second, let me just go back because I'm trying to, so we were here. But once you create those boundaries, we can then, is it going to let me or probably not? Okay. So then you can take it off and you can create your own boundaries if you want. And then also it'll create a final finished surgical guide with the pilot holes, as well as you can create windows just like you would. And you take it to your 3D printer. Half an hour later, you have a surgical guide. You put in your sleeves, and off it goes to the clinician. So it's really, hopefully you saw, it's a very easy process of being able to do a surgical guide. Now, as I said, as we have a little bit more time, we have about 10 minutes, so I want to be able to really properly show you the entire suite of Nemotec. But they have a really great, what's called a Nemo Smile, which is a smile design, but it takes it even a step further. It's not only facial harmony, but it's also function. It's facially driven, followed by DSD from Christian Korchman, who Dr. Christian Korchman, that is, who they work with on the software, so you're able to get true smile design. Now, this is a kind of, there's clinicians out there that are doing either a facially driven, really quick teeth analysis for orthodontics, or even for a composite mock-ups that you can even create as a dental laboratory, a guide in order to do composite mock-up for a smile design. As well as, obviously, you have the 3D integration, as you see here. Now, these are some of the products that are available from this smile design, or a smile, Nemo Smile, because you can do a motivational mock-up, which is very similar to what is our previous or diagnostic wax-ups that we had. So to show the patient, again, it's more of a textile, they're holding it. Then you have the pre-treatment ideal and the post-treatment ideal, which is mock-up similar to this. So you can create a 3D printed mock-up that you can actually either, I prefer composite, but others have even done some acrylic, so that it temporizes the patient and it shows them what the ideal scenario will be, and it's rather quick and easy, but you can do that very easily. You can also obviously do with aligners. You can do shells out of composites, either milling or 3D printing, but I think milling, being that is that thin, as well as crown lengthening. You know, we have crown lengthening that we do in an analog way where we actually cut out, but now we can do this digitally and just 3D print, so our either GPs or periodontists really prefer. So it's a nice and clean and aesthetically driven kind of guide, so you can get your exact tooth lengthening. And last but not least is a control pre-prep guides. So now the dentist can see how much they need to prep, where they need to prep, and obviously they have the windows in order to do so. So that, again, the idea is to get the best outcomes that is possible in every way. So that's a smile design. Sorry. If you could kindly answer that. So now the next step is going to be the showing you the NemoCast and NemoCef. Now those two, and the following one that I'm going to share with you are, you know, at a very high level. And quite honestly, it's remarkable what we can do. With that said, most labs don't get involved with this, but some labs that are niche can, and I think it's a great opportunity for those that wish to, because the revenue stream that you can attain from this is incredible. Because whether you're doing orthodontics or you're doing diagnostic or even TMJ, kind of, or even sleep apnea, all these kind of come into that role, because now you're looking at how the angulation and the space of the individual teeth and how they work together in harmony, which is what the patient's biological situation is. So you can incorporate virtual x-rays, ceph tracing, VTO, STOs, and so many more, but they align, and at the end, it can give you even a liner production or indirect bonding guides. So it really offers you the setup and the staging. And I have to say, I've seen a lot of, especially ortho type of software, the information that you're able to get from NemoCast is, as far as I'm concerned, is some of the best that you can. Because not only are you looking at segmentation, not only are you looking at rotation along the XYZ and the R rotation, but the ability to really, virtually create these planning, and then that's the benefit of the world we're in with virtual reality and software, because you can see the outcome of the case before even committing to the case. And that's really, really powerful. So not only can you measure the outcome, measure the success of what the orthodontic treatment is, but once you're satisfied and the clinician is satisfied, you can duplicate that consistently by being able to either create aligners or create even um, you know bracket guides that for the orthodontist to be able to bond those guides in. So there's a plethora of other opportunities as well as morph planning that you can really achieve. So here's some examples of what will produce from it, which is aligners, which is a huge opportunity. I mean, the aligners business is something that's growing exponentially and more people are getting it. Aligners, that is, and now you have the ability of doing it if we're in your laboratory very easily and cost effectively. And again, it's an ability of not only is it on your PC, but it's also cloud-based. Or you can get involved with orthodontists rather, to offer them an indirect bonding, as you see here, where they just place the brackets in, they bond it, they light cure it, and off the patient goes, as well as direct bonding if that's the pathway that they choose. So the opportunities are really, really large here, and especially in the ortho arena, from aligners all the way to direct bonding and indirect bonding of brackets for wires. So it's really you can satisfy. But what's more powerful? Yes, these are the end results of the products. But what's powerful is the analysis that the software allows you. It's incredibly robust, and you can do some amazing things, amazing movements, and when I share with you the next kind of phase or the next type of Nemofab, it'll really blow you away. But this is where it all kind of starts from. So surgical guides is something that we do and is done, which years ago we used to think is complex. It has become significantly easier. Now we're moved into more of a treatment planning, moving, manipulating the teeth for ortho. But the next step, which is I'm really excited about, is the Nemofab, which is the maxillofacial. But here, if you're not in the orthodontic space or looking to get into the orthodontic space, this is a perfect scenario where you can really learn the software and be able to 3D print the models or what have you. Now they're 3D printing aligners as well, all the way to the trays as you see here. So that leads me to the last segment, which is the Nemofab. And I think there's another, if I'm not mistaken, another set of questions that will be coming up soon. But thank you. If you would be so kind as to answer. Now, Nemofab is life-changing in many ways, and I'll share with you a quick video of those changes. But this is more orthognathic surgery, so you're able to change or move people's entire maxilla, people's mandible, extend it, shorten it, the chin, osteotomy guides, and so much more. Everything that you can do with the same software, the same kind of data acquisition, the Diacom as well as the static. But laboratories can engage in this. In Europe, they do, and here in the US, they can if they choose to, but they could offer a slew of different types of solutions for their clinicians. So obviously, in the TMJ and the airway analysis arena, the ability of moving teeth, moving bone in order to alleviate any kind of airway issues or even TMJ issues is incredibly powerful. Does take a little bit of a learning curve to understand and really immerse yourself into that arena, but there's very few players. So truly the opportunity is huge but it's a very complex and robust opportunity. And there's some good profits and revenues to be made. It just, the software really, really makes it that much easier. Allows you to virtually surgery planning, allows you to create splint designs and productions, as well as the osteotomy guides and production. So what you end up with is osteotomies like this. Again, the design you can certainly do, but if it's splints with for TMJ, you can remove, obviously shorten or lengthen. As you see here, you can create these jigs for the chins. And also if you wanted to shorten, so you can take a section of the mandible for argument's sake, and then, if the dentist wanted to shorten the mandible by about 5 millimeters on each side, they can take it, slice it, and now you have the custom plates in order to correct it. So it's truly life altering. And what do I mean by that? So this patient, and just notice the changes in her face, has gone through the surgery that you see at the very top. It completely transformed this patient in a great way. And it was just exactly the type of surgeries that I just shared with you, where the chin was developed and perhaps the maxillary bone was brought in, as we can see from the very top. But it creates a really dynamic and life-changing for that patient. I mean, if I didn't know any better, I would think it's two different patients that we're looking at. And in fact, it's the same patient that was helped in many ways by clinicians as well as laboratories in order to create that. But they've had extensive, obviously, splints as well as any kind of guides, and even including ortho, but to end up with that kind of result. So it's really powerful. It's what you can do as a laboratory if you so decide. The good news is the tools are here to do it. If that's what you want to do, then certainly the opportunity is here and the tools are here, as well as any of the trainings that come along with it. And it's incredibly cost effective, being that it's a package, on your local computer, and it's cloud-based as well, makes it incredibly cost effective so that you can create these life-changing, dramatic opportunities for these patients, whether it's osteotomies or surgical guides or implant prosthetics and everything, and orthodontics and everything in between, can really, really make a tremendous impact for your dental laboratory, your clinician, and ultimately our dental patients. So with that said, I just want to thank you all for your time. Hopefully you've learned a little somewhat, and have benefited in the value of just the opportunities and what is available for you, should you choose to exercise it. But the tools are absolutely remarkable, and this is a very, very robust and phenomenal software, and I encourage you to, at the very least, try it. Thank you.
Thank you, Dan. We're going to open up to questions if anybody has questions. Right now, you could just type them in for Daniel. But I just wanted to go over the polling questions, what the results were, if that's okay, if you want to comment on any of that.
Sure.
So we had quite a few people that decided to answer for us. So I want to thank everybody for getting involved, because it means a lot. And right now, for the first question, are they currently fabricating surgical guides? And right now, 40% are saying yes, and 60% are saying no, they're not. So do you have any comment on that at all, Dan?
No, so I'm happy to see that, 40% are doing it. I'd like to see more, and hopefully that'll be the case. Look, at the end of the day, I mean, there's opportunities to be had both on the business side, if you will, but I also look at on the patient side. Studies show, statistics show that surgical guides makes implant success better for patients. So, and it's also a revenue stream for the dental laboratory. So if you're not cultivating that, you're not creating that, you might just be missing out on something. And again, as I said, with the general practitioners and the oral surgeons opportunities, that's a revenue stream that you can tap into, and through the strength of a surgical guide. It's a service, it's a product that we're providing our clinicians that actually help our patients be more successful with their surgical and implant prosthetics. So I encourage you. I'm happy that the 40%, but I think that number is gonna grow.
And the next question that you provided us was if these stackable surgical guides would elevate the lab's offering, and 80% say yes,
Excellent.
and 20% say no. So I think the 80% number is great, so people understand that there is a great benefit to being able to produce these in-house. So that's good.
Absolutely. And if I could just add to that, and I'm so happy to see that and hear that, because again, I'm a big proponent in dental laboratories having their seat in the restorative table, right? So what better way to sit and not be reactive but be proactive than to sit at the table and making these decisions alongside of the oral surgeon, the clinician, the pros, and so on. And we have a lot to share. We have a lot to input into this. And I think a stackable guides, especially on an all-on-X type of restoration, really does that and puts us in a consultative approach rather than a reactive approach, so that we can help drive the ship to the best outcomes, because we have a lot to offer, and I hope you all share that.
The next one, cloud-based platforms, are they excited or concerned? So 50% are excited, but 50% are concerned. So I don't know how you feel about 50% being concerned, and if you could ease anybody's mind on that.
Yes, absolutely. So what I'm learning also with when it comes to AI and things like that, but that's a whole other big topic. But when it comes to cloud-based, it really comes down to computing power. The reason why cloud-based really helps in a big way, because it actually helps us get those calculations and generate those STLs and as well as those outcomes. Because truth be told, if we relied on our local PCs, we may just not be able to do that successfully with our local. Some may have a better graphic card, some may have a better CPU, whatever the case may be. When you're getting into the cloud, a lot of the computation happens there, which is more robust and allows us to do better things. But it's also a huge communication collaboration platform, because you, as well as the clinician, as well as even the patient, I don't know if you want that, but even the patient can tap into that, and it provides a HTML viewer. So nobody can access it other than anybody that's allowed to. So hopefully, security wise, it puts you at ease. But the benefits that come from it are significantly greater than some of the risks that may come from it.
Awesome. So if anybody has any questions, please type them in at the bottom. And I appreciate all of you answering the questions. Really, really happy that you were interactive with us today, because we look forward to that here on Zahn Academy. We like to be interactive with our audience just to see how you feel about things and where you're looking to go as well. I just want to give you a little update on what's coming up next on Zahn Academy. June 20th, we have Printing Permanent Bridges from Theory to Practice, which is going to be featuring Bago's Trinique resin, and that's going to be with John Madden. So please join us, sign in for that, register for that. We look forward to have you. We have our road shows coming up. Right now in June, we're going to be heading over to Columbus, Ohio. In July, we're going to be going to Indianapolis, Indiana, where we will also be doing a 3Shape design course. And then in August, we'll be heading back to Orange County, California. Daniel and I were just at LMT West together over there. So we're going to be heading back to Orange County. And again, we're going to be having a 3Shape design course there as well. So take a look at Zahn Academy, zahndental.com for information, and sign up as soon as you can, especially for the 3Shape courses, because we will just be taking 10 designers. So we want to make this as one-on-one and hands-on as we possibly can. So take a look. If the scheduling is good for you, join us. We'd love to have you. We will also be having a 3Shape design course at our technology center over in Wakefield, Massachusetts, and that will be held on July 26th. So if you're in the area, the Boston area is beautiful. If you're close or you want to plan a trip to Boston, please join us. And that will be again on July 26th. Okay. That's a full day course, and it's a lot of fun. And so are the road shows. So take us up on it. Join us. We'd love to have you. I want to wish everybody a great rest of the day. And Daniel, thank you. Thank you as always. You're a great friend. You're a great friend to Zahn, and your lectures are great for our customers. So we really appreciate having you.
Thank you, and wishing everybody a happy holiday.
Yes, happy Memorial Day. Beginning of summer, everybody.
Indeed.
Get out there and enjoy it. Have a great afternoon. Thanks again.
Take care, everyone.